Welcome to the Innovation in Healthcare podcast, produced by Health Innovation North East and North Cumbria, which supports the health and care system to accelerate innovation to improve people's health and the regional economy. This podcast showcases some of the work that we do to transform healthcare by driving spread and adoption through cross-organisational activity and collaboration. In this podcast, Lillie from Health Innovation North East and North Cumbria and Dr Matthew Sawyer, a North East GP and Director of SEE Sustainability, explore the NHS commitment to reach net zero and discuss some of the positive things that can be done to affect climate change, alongside some of the drivers for change that we are seeing both regionally and nationally. And the theme for this episode is the small things that make a big impact, introducing how we can all play a part in making small actions that can make a positive change to our health and the planet.
Okay, first of all, Matt, thanks very much for doing the podcast.
Absolute pleasure.
I really appreciate it. I think for me, one of the reasons why I was so keen for you to come and sit down and have the conversation was I think we've known each other for a couple of years now, and one thing that I've been incredibly impressed and empowered by was your commitment to sustainability. And I think if we could just start off with, if you wouldn't mind telling us a story from the drive really to go from a GP practitioner to moving completely into the sustainability, to impacting sustainability in the way you've done. If you wouldn't mind just really give us a bit of background on that and tell us why.
Yeah, so I became a doctor and then a GP and spent quite a number of years seeing patients. You know, they came to the surgery and of course you do what you can for the person that was in front of you. But I think that it was a bit of a frustration at some of the wider determinants of health, some of the prevention, and how that sort of linked to the natural living world, the environmental and sustainability agendas, really. So I think for me it was a bit of frustration at I can only do 30 things a day for the 30 patients that I see, and yet there's hundreds and thousands and tens of thousands of people who actually could get more benefit by us collectively doing things differently or doing more things which have got less environmental impact. And I think that for me it's not just about an awareness, but it's about the doing. It's about the taking action. And we can raise awareness as much as we want, but actually it's how do we empower people to actually do the doing. And I think people have got great intentions, but they don't always know what to do or how to do it. And so for me, I think it was, well, if we want to improve people's health, population health, nationally or internationally, globally, what sort of things could we do, should we do we need to be doing, and how can we actually have better health outcomes for people, better health outcomes for populations, better outcomes for the natural living world and from a planetary perspective. And so for me it was trying to wake up each morning and think, well, we can't continue to harm the living world in the way that we are, because actually that causes a lot of negative health that has a lot of impacts upon us, as we'll go into a bit later. And so for me, it's how can we do the best that we can for patients and planet simultaneously.
Great. And it's really interesting, isn't it? Because I think that one thing that you can ask yourself is, am I making a difference? Can I contribute? And I think when we looked at the title of this specific podcast, which was The Little Things That Make a Big Difference, one thing that I was kind of questioning in my own mind when we were setting this up is, are we making light of the fact that we are in a climate emergency? And are we trivializing that a little bit by saying, oh, well, if you just do a little bit, you make a big difference? However, the other question I have is people, and how do you feel like as an individual that you're making a difference if you're not in a place of government or you're not in a place to empowered to make the big decisions? So I guess from my perspective, I was interested in your take on that and whether you see, the small things to be able to make a difference, or whether we should just put as much pressure as we can on, the people that can affect legislative change. I was just wondering what your take was on that.
I think that really there's three different parts of society that all need to do their thing, their bit. We've got government and the law and a legal approach. We've got business and what they supply and how they supply it, and then we've got the public, the consumers who are purchasing it. And so any one of those on their own, I don't think is necessarily going to achieve all of the things that we as a global population or as a planet need to achieve. So yes, we as individuals need to do things, but we also need government to do things. We also need business to do things. A way that we as individuals can influence what businesses provide is by buying the things that we know are less environmentally impactful. So we buy more of the good stuff and we avoid the bad stuff. Part of what we as individuals can do is we vote. We've got a democracy. And we can say to politicians, actually, these things are important. We want to have clean air to breathe. We want to have clean water to drink. We want to have food that's not going to be contributing to ill health. So we've got power to make changes. I think that if we think small and do small, we will stay small. If we do something like, but I double print on paper. Okay, that's one small action. Keep doing it, but don't think that on its own is going to make a big difference overall. So lots and lots and lots of little actions cumulatively and incrementally can make a difference, but we can't do one small thing and say, but I've done it, and stop it there, because that just won't get us to anywhere where we need to be. If we think about the amount of damage and harm that's being caused, little things will only get us a tiny fraction of a way to where we need to be. So it's doing things successfully, but then realising, actually, what's the next thing I can do?
Great. So do you see it more as a journey then than a kind of an elemental thing, or is it both?
Yeah, I mean, absolutely. I think it's a journey. I mean, I think that we need to do big things to make changes to continue for us to have a habitable planet, really. And if we don't have an incremental approach, then we're just not going to get there. So yes, if this week you say, I'm not going to go completely plastic free in everything that I buy in a week, but actually today I'm going to have a reusable bottle, or I'm not going to have disposable cups. Brilliant. Okay, what about tomorrow? Okay, well, tomorrow I'm not going to have plastic carrier bags. I'm going to have a bag for life. Okay, what about the next day? And so each day you can do something different, something more than the day before, but you can't sort of on the second day say, right, I'm not going to have a plastic bag at the supermarket, but I'm going to go back to disposable cups. It's incremental. It has to be a continual improvement, really. So I think that we can get there. We know what we need to do. It's just a matter of doing it. I say we know what we need to do. Actually, a lot of the time, people are aware of. There are some people who know exactly what we need to do, but the problem is that there's a lot of myths about some of the small actions and how important they actually are. And we can come on to some of the details, but there was a great research paper out a couple of years back that basically listed or ranked how impactful different actions were. And things at the top were things like going car-free, reducing the number of journeys by fossil fuel, changing what we eat in our diet, and right down at the bottom of the list were things like going paper-free or recycling. And yet you ask people, and they put recycling far, far, far higher up the list. So I mean, by all means, do recycle, but don't think that is a big enough action to make a significant overall difference.
Yeah, it's interesting. I mean, I think there's a balance, and there's almost a question in people's mind of it's what's easy to do, what's difficult to do, and how you can affect both, and how those levels of ease to difficulty make the biggest change. What's your view on that? So in other words, for example, recycling now is relatively easy to do.
It should be easy to do, but there's still barriers. So absolutely, we need to find a way to make all of the least environmentally impactful actions the easiest. So we need to grease the wheels of the best actions, and we then need to put sand in the wheels of the ones which are worst. And so, for example, it's things like if I was going to travel from one town to another, what's easiest? For me to get in the car, put it into the sat-nav and get there, or is it to get the bus to the train station? The train, is it on time? Where do I get the tickets from? If they're going to close ticket offices, do I know whether it's the right ticket? When I get to the other end, is that close to where I need to be? And so suddenly we've got two journeys, one of which feels easier, because that is then sort of, but it's just normal to drive. And it's how do we add friction into the ones that are hardest or that are worst. Cycle lanes, we have a protected cycle lane, actually get more people cycling. We have signs here in Newcastle, for example, telling pedestrians where they can walk, how long it might be to get to the town centre, for example, from the train station or to St James's Park. And actually, these are the actions which, so we've got some infrastructure in place which says, and this is how easy it is. So for me, we need to be finding ways to make the best actions, the least environmentally impactful actions, by far and away the easiest. And we need a few carrots, and then we need a few sticks for some of the other more harmful actions. Town centre car parks, if we had a traffic-free town centre so that pedestrians and cyclists and wheelchairs and pushchairs actually had right of way, and not that we put car parks in the middle of town centres, suddenly we start changing that balance between what's easy and what's hard.
It's really interesting. I mean, I think that I guess the question is how do you take a political football like the environment, which you can see by the local by-elections recently, it has become that, because there's a bit of NIMBYism in there, there's a bit of kind of, okay, this is what we want to do, but you then take that football, but how do we then empower people to take control of their own actions, and how do we then allow people to feel like they're being impactful irrespective of what's going on from the political kind of agendas that are quite difficult to affect, apart from the vote, which obviously is critically important, but in terms of the day-to-day living, how would you say that the best way to affect that would be?
Well, just going back to the elections for a second, I mean, I think that one of the current analysis of whether the low emission zone in London was a reason that somebody got more or less votes than somebody else. I think the frustrating thing is that actually it's almost focusing on the wrong thing. I think that if you ask 100% of the population, would you like clean air to breathe, you're going to get 100% response, yes. There is nobody who would say, no, I'd rather have dirty air, thank you very much. I'd rather have polluted water. I'd rather have contaminated soils to grow my food in. It just doesn't happen. So for me, the question isn't, should we have a clean air zone, whether it be London, Newcastle or anywhere else, but it's more, how do we achieve that? And that, for me, is the more critical question. So Eddie Kissy Deborah's mum was on the radio this morning and very much saying, this isn't about if, it's about how. And I think that that's right. So if it's the cost of living crisis, I can't afford to replace my car with a cleaner version of it, well, to me then the question is, what sort of incentives could or should there be from government or from local authority to be able to replace that with a scrappage scheme? We've had multiple scrappage schemes for cars over the years. This is about the how, not the if. So I think that the frustration is that this sometimes goes back to inequalities. Those who contribute the least, so when you look at the number of or percentage of people who've got cars, if you're in the lowest 20% of the population in terms of income, a third of people don't have a car or don't have access to a car. So actually these are not contributing traffic fumes to the town or the city that they live in. So why should they be breathing in dirty, polluted, traffic fume filled air when they don't have a car to contribute to it? And so for me, I think that there's a real balance between some of the vehicles that are being driven and how we get people to be able to make the change, because those who are breathing in dirty air tend to be those who are least able to accept the impact of it. They've already got health issues, they've already suffer from inequalities in a host of other ways. So I think that some of the questions that get asked, or some of the political framing of some of the ideas around environmental sustainability, thoughts, ideas, targets, actions are a little bit misled. On housing, for example, housing is a hugely important determinant on health. If you want a healthy population, we need to have a healthy housing stock. Again, if I said to 100% of people, would you rather have an energy ineffective house that just leaks heat out of the walls and out of the roof and out of the windows, or would you rather have somewhere which was nice and cosy and warm and didn't cost very much or didn't cost as much to run? Everybody's going to say, I'd far rather have a cosy home which with lower bills, thank you, because that's what we would all like in the winter. So for me, is it saying that we're going to lag pipes and put wall insulation and loft insulation and double glazing in? Are we doing that for an environmental benefit or a financial benefit or a well-being benefit? Well, actually, we get all three.
Yeah, and that's a really significant and probably for me one of the critical points and one of the reasons why I was so keen to get you in here, Matt, and discuss these, because I think having an understanding of health inequalities and also having a very good understanding in terms of what net zero is. You can talk about CO2 equivalents and things that are quite difficult to understand. But health inequalities aren't difficult to understand because they are very real to a lot of people. And as you said, I think the people that it affects, one of the questions you've got to ask is, how do you relate the conversation around the environment to health inequalities? And what do you think the education process needs to be around that, and how do you think we could positively affect that?
I think some of it is talking about co-benefits. So this isn't about we're doing an action for just one gain. So we're not just doing something for an environmental gain, but actually there's a financial gain, there's a health gain, there's a well-being gain. So actually we can get multiple things. So green spaces, for example, we know that green spaces do a lot of good. We get a lot of nature, a lot of different species, a lot of animals, a lot of plants growing in green spaces. So from a planetary perspective, we get a big green tick. But we also know that when we've had heat waves, that it's far nicer to sit under a green tree, or any colour tree, sit under a tree, than it is to walk down a high street where there's no protection from the sun at all. So actually, we've got some cooling benefits in town centres during heat waves. We've got mental health benefits, so that we know that people who live closer to green spaces or who have more access tend to have less depression, less anxiety. We know that people want to spend more time outdoors in hot weather, for example. So we've got some financial benefits because we're not having to pay for cooling because we've got nature-based solutions. We know that trees protect from flooding. So actually, are we planting a tree just for an environmental gain, or are we getting all of these other benefits as well? So for me, multiple green spaces across towns and cities have got many, many benefits. So it's not that we just do one thing for one reason. So I think part of the education is is asking people what's most important to you. So, for example, you ask a hospital and you say, what things are important to you, or where's your most complaints? And they come back, well, it's car parking. Okay, well, let's just build a bigger car park. And of course, that's not really the answer. So we can actually tackle some of the problems that people are facing through more environmentally aware, more environmentally sustainable options of active transport, shared lifts, getting people out of cars, which then also has the benefits on air quality. Yeah, absolutely. So we're getting multiple... And I did some work with Birmingham Women's and Children's Hospital and asked them to put in their postcode into addresspollution.org, which tells you how good or bad your air quality is. They were the 98th worst in the country on the pavement outside the accident and emergency department from the Children's Hospital. And suddenly you could see the penny drop. Yeah. This is why we get so many kids in with respiratory problems. We've got terrible air quality on our doorstep. So actually, from a health service, if we got people out of their cars, we're solving the hospital car parking problem, and we're reducing the number of admissions of kids into A&E with respiratory problems. Well, reduced workload for staff, That's a big tick at the moment. We know that staff are overwhelmed. Not having your child go to hospital because they're not having health problems. Well, that's a big tick for families because they don't want their kids to be in hospital. So actually, we get lots of benefits from trying to tackle things through a more environmentally sustainable lens.
I think it's really interesting because there are tasks around the drive to net zero within the hospital. And the question is how do you take it from the hospital estate itself and make it about the broader health inequalities and balancing those? It's interesting that, as you said, if you look at where the hospitals are, and a lot of times they are in quite heavily polluted areas, and are contributing to them as well. So I guess the question is around, again, going back to this health inequalities, and, one of the other questions is around indoor and outdoor air pollution, because, there's a lot of focus on what goes up in the air, but actually when you're in the environment that a lot of people are in when they are struggling and where they have got challenging situations and they haven't got the ability to go to a garden to sit in, when they are enclosed within, more confined environments, indoor air pollution becomes a huge issue.
Absolutely. And I think indoor air pollution has been something which has been overlooked and a bit of a Cinderella topic for some time. And certainly some of the Chris Whitty's Clean Air report last year highlighted that indoor air pollution, so burning stuff, whether that be on a coal fire, whether it be on a log burner, for example, whether it be candles, even things like frying and burning food or under the grill, all release both gases into the environment, but also particulate matter. And some of the particles are so small that they're ending up getting into our lungs and then into our bloodstream and affecting organs around the body. So indoor air pollution is as important, particularly if you're stuck inside. And I think that COVID probably highlighted, particularly during some of the lockdowns, that people were just within four walls. And so if you've got poor indoor air quality, you're just going to be making the situation far worse. I think that for me, this sort of ties into the wider picture that burning things generally releases both gases and particles. So whether it be fossil fuels in vehicles or in diesel engines, for example, or things within a house that you're setting fire to, candles and log burners, how can we not do that? So from a travel and transport perspective, or from a heating a house perspective, how can we electrify things? How can we do it so that we can be more reliant upon clean electricity generation, so whether it be nuclear or solar or wind or wave? If we can electrify our heating, we have we have warm homes with clean air. If we can electrify our transport, we can still get people and goods from A to B, but without some of the contributors to the air pollution at the moment. I know people like candles, and I know people like the smell of them, and I know people like joss sticks. And I think that some of this we have to take in balance. If you have a birthday and you light some candles once a year, I think that's probably going to be okay. I don't know whether you're an Instagrammer. I don't know whether you've got photos of candles around your home that are all on fire, but you do that every day.
Yeah.
And actually, it's quite a significant overall impact.
Yeah.
So it's not just how many, but it's how often as well. Yeah. So overall, burning things generally, I think, is pretty bad from a personal, from a patient, from a population, and from a planetary impact.
Yeah, it's interesting. I just going back to the elections. One thing that just sprung to mind. On Saturday, I opened a letter from the from the mayoral office of London, telling me about ULEZ and telling me about the fact that this congestion charge is coming in. So I'm based in Teesside. The likelihood of me driving the car that I was going to drive to London in that zone would be very, very unlikely indeed. And I wonder how many people have got letters delivered through the post warning them about this specific clean air emission zone that's going to be coming in for outer London. The point that you were making around the process of implementing change, if you look at that and you magnify that by the thousands of letters that have gone out, and the actual impact of delivering those letters, which is supposed to be positively affecting environmental change, the logistics of doing that are skew-whiffed.
I think it's difficult because on the one hand, you're going to get people who say, but you never told me. I didn't know I needed to apply for a permit, or I needed to pay for a congestion charge, or how to do it. So I didn't do it. And then it's how you balance those two things up. And this is going back to how do we make it easy?
Yeah.
So actually, you almost think that if there was a QR code on the outskirts of London, I know that this is slightly far-fetched, but almost a QR code that you could scan on your way in that would pay your congestion charge as you went. How can we make it so easy for people? A petrol station at Watford Gap almost, that you can stop and do electronically, do it online before you even enter the city. So it's how do we make this as easy as possible? How do you know what vehicles are exempt? I don't know whether my vehicle would be exempt or not. And so it's, I think this is all part of that planning for the actions that you and I might take, or that we might take collectively. What do we need to do, and how can we make that, how can we turn the intention to do less harm into action?
Do you think this is gender and age specific? Do you think that there are groups that are more proactive than others, and do you think there's a way to affect those that maybe aren't so proactive to be more proactive? Yeah,
so there was a good piece of research that was out a few years back that, and it does depend on what the actions are, but that looked at different age and genders and how pro-environmental they were. And actually it was ladies in their 50s who were most pro-environmental. And I think that some of the theories behind this was that if you've watched your kids grow up and you've nurtured them and you've taken care of them and they've now flown the nest, you've now think, well, what else can I nurture? What else do I need to look after? I don't want my children to enter a world where there is, water pollution, air pollution, litter, all sorts of other harms that we can see going on. And so we've got, a group of 50 to 60 year old women who are saying, actually, I want to leave the world a better place for my kids who are now released into it, and for their grandkids and for my extended family. So I think that it's almost trying to harness the drive that different people have at different ages. The drive that you may have had when you were in your teens or your 20s may well be different when you were in your 30s or 40s, because family situation, how old your kids were, whether they were flying the nest, all sorts of things sort of play a role. And so I think it's trying to find a way to enhance the different messages for different age groups. You don't have the same message for everybody.
Do you think Pester Power's got a role to play in this?
Absolutely. For some, it's their kids who are the driving force. For others, it's the older generation. It's different across the board. And I think that, some families have got kids that are very, very switched on for whatever reason, but you've got other families that haven't got kids that are switched on because they've missed that part of the what's the impact on the natural world, what's littering, all sorts of things that have almost bypassed people. And I think that some of that might depend on whether you grew up in a place with green space or without. So again, more studies have shown that if you don't know what a tree is, why would you want to look after it? If you don't know what animals or species live nearby you, if you've never seen a hedgehog, why are you going to care about hedgehogs? It's an alien species to you. So It's how do we introduce people, or how do we give people that regular contact with the natural living world that we know provides us with everything we need for a habitable planet, and how we can sort of engender that care into looking after our home, really.
Yeah, and I think there's a socioeconomic disparity, isn't there, between who has visibility of that and the point you made earlier on, which is that the people that are affecting it, that affect environment, the environment that negatively the least, are probably the ones that are
suffering the most.
Yeah,
absolutely.
And so, but I'm trying to think in terms of how do you empower those people to affect change? how do you empower those people on a day-to-day basis to effect change, to make a difference to their own environment? Because a lot of this is about, I think that systemic change will take time, but one thing that I think around health inequalities that I would be really interested in your perspective on is that, how do we empower people to make a change, to own the change, if you like?
Absolutely. And I think that is tricky, and it's different in different situations. So, for example, I work with myself and a friend run our local litter picking group, and it was set up by my friend, and she did it because she'd moved to a new place and she was a bit socially isolated, a bit lonely, and wanted to meet people. And setting up a litter picking group was one of those ways that she could do it. So she didn't ask anybody for permission. She didn't, advertise for anything. She contacted the local council and said, "Can I have a litter pick gear?" And they said yes, and it kind of just snowballed from there. So for some people, it's I just want to do this, and so there are some actions that you can take on your own. So she did it for not selfish reasons. I mean, she did it because she wanted to meet people, which she did, but actually she made the world a bit of a better place as well. Conversely, there was a great story out of Barcelona. There was 5 parents who said, "I want to be able to cycle my kids to school." Again, they didn't need to go through and ask permission for anybody. They just got on their bikes and started cycling their kids to school. And within something like a week or two, they had 300 families all cycling their kids to school, because suddenly it was something that, they're doing it, and that was, I wish I'd been able to do that.
Yeah.
Well, now I can. So I think that there are some things where people can just do it, and just there's quite a lot of things that don't actually need a lot of necessary local authority support. For example, there are things that we can do right now today, which we can go and pick up litter now. It's not something which we need to apply in triplicate to a council meeting to do. So I think that there are a lot of actions that we can take to improve the natural living world around us. I think the frustration for me is probably those who earn the most tend to cause the most harm, because they have bigger cars, they have bigger fridges, they have bigger houses, they have more holidays, they fly more. And so for me, it's how do we empower, or how do we enable those who cause the most harm to be able to reduce their impact? How do we get the more affluent, the more successful? And that's another of these health inequalities, that the people who cause the most harm tend to live in the leafiest suburbs and be least harmed by the impact.
It's really interesting. So what we have a sheet of paper, and we say to those people, right, here are 5 things, or however many things, that you can do to positively affect environmental change and take ownership of it. For me, there is, and talking to lots and lots and lots and lots of people about this, it tends to be an open door, but it's a directional thing. And it's also a little bit, it's not my issue, it's somebody else's. And it's pointless me doing this because it's too big a thing to affect. So if we can be quite prescribed and say, right, okay, here's 5 things, or however many things that you think, would be the top 3, however you would say, what would you say they would be?
I think I would probably break it into, there's some things that we can do personally. You and I, individuals, don't need to ask anybody's permission. We can just do it. There are some things that we need to do, or we can do professionally, and it obviously depends on what our profession is. If we work within a hospital ward, for example, or a GP practice, for example, the actions that we can take professionally are going to be different. And then there's things that we can do systemically, or thinking bigger. So there's things that we can do within each of them. We've talked about some of the personal actions, but other big ones, looking at your personal diet. There was a good paper out recently which showed the amount of impact that meat has, both on us as on our personal health, but also from a planetary perspective. And then thinking about travel, whether it be daily travel, work travel, education travel, holiday travel. There was an example of of a practice, so I'm moving slightly from personal actions into professional actions, that a practice looked at where some of their staff were travelling from and recognised that 4 of them lived within a street or 2 of each other, but they were all driving the 3 miles each way to work. And the practice manager said to the staff, "Why are you travelling individually?" And they said, "Well, we love each other outside of work, but our shift patterns, our start and finish times don't coincide." And so the practice manager said, "Well, if we change that, would you travel together?" And they said, "Well, we would love to." And so suddenly we took 3 out of 4 cars off the road. So that's everybody's expenses, the money that they were shelling out on fuel went down to a quarter, so they had more money in their pocket. Staff morale went up because they got to spend time with their friends on that 20 minutes to and from work. Air quality improved because there were less cars on the road. So actually, there were multiple gains, whether it be individually or for the practice or for the patients or for the population or for the planet. So I think that there's some really useful things that we can do as individuals. I think from a professional point of view, again, it very much depends on your profession. I think that one of the things that I would advocate people doing is to tell their story. Why are you interested in it? Why do you care about the litter? Why do you care about the trees or the plants or the animals? Is it because of your kids' health? Do you not want them to breathe in dirty air? Talking about why it's important to you can help other people say, "Well, yeah, actually, that's important to me as well. I hadn't realised that, my kid was in your class at school. And, yeah, well, if they're both, suffering as a result, maybe we should do something together." So I think that telling your story, it means that it attracts other people to you. And then it's having those sort of, practical solutions of, well, how can we tackle this? I think that, working as a team, whether it be in the workplace, whether it be within a family unit, whether it be within a group of friends, can be really, really important, because actually that's what gives us energy. I mean, if one of you is feeling a little bit down or despondent, actually talking to somebody else who says, "Well, I think I found a way, I found an option, I found a solution, I think we can do this," actually can be the thing that sort of brings you back up and helps reinvigorate and re-enthuse yourself. So I think talking to others professionally, what's going on in the workplace, what can we do that's different, and I think lobbying for change. I mean, we've talked about a bit about making yourself visible. If people are doing a good thing, tell them that they're doing a good thing, because actually that will encourage them to do a good thing again. So whether that be a politician, a local councillor, somebody who is picking litter on your street, support them.
I think there's a heck of a lot to be said for positive reinforcement. I think you mentioned earlier on around carrot and stick. It does form part of the human psyche, I think, to, the more you're encouraged and have a positive aspect on something, the more likely you are to repeat it. And one of the questions I have around the positioning of the climate emergency, which we are in, it's absolute, is, so what do you do about it? And it is the so what question, because for me, and this is one of the reasons why I was so keen for us to have this conversation, is to allow people to do things practically and to empower them to make a difference, however big or small that is. It starts them on that journey.
Yeah, I mean, absolutely. And I think that it is a journey, and I think that, it's knowing that we can all do something today and we can all do something else tomorrow and next week and next month, whether that be, guerrilla gardening and planting sunflower seeds on, roundabouts or whatever it happens to be, that, we can all do something. I think the frustration sometimes is that we're not always sure what the best things to do are. Just thinking professionally about what we can do. Whether it be single-use equipment, and there's a great website called healthcarelca.org, which has got lots of peer-reviewed papers on what's the environmental impact of single-use versus reusable equipment. And spoiler, reusable is far better.
Surprise, yeah.
I know, so reusing things is actually far better. So how can we extend that into everything else we do? How can we buy things so that they are there for longevity, so that we do reuse them, we do repair them, we refurbish them, we make better use of them? So anything that is leaving our profession, our business, our ward, our practice, what's happened to it? Is there a way that we can make better use of that, either ourselves or other people? It's looking at things like care pathways. There's a great example of low environmental impact cataract surgery from India. So in the UK, cataract operation creates a whole lot of waste, a whole lot of greenhouse gas emissions, somewhere between about 150 and 180 kilos of carbon dioxide equivalent per operation. In India, same operation, less than 10 kilos.
Wow.
We can reduce by 95%. So planetary, that's a good thing. Actually, patient outcomes are better. There's a lower infection rate. Financially, it's better because we're using so much less kit. And so suddenly we start seeing that there are alternative ways of doing things professionally that we know about right now. We're not waiting for some, billionaire to sort of, come along and create something new. We know what we can do. It's just a matter of rolling that out and doing it across the board. So I think that there are a whole host of things that we can do personally, professionally, and from a system perspective that we can take and do now.
Brilliant. I think one of the key takeaways that I'm getting from this conversation, which is I think really important and empowering at the same time, is the fact that when you do start to make a positive change, it's multi-beneficiary. So it's not just a positive effect on the planet. It has a personal, it could be financial positive effect. It has a social effect that you could get out to meet more people. It has a physical effect in terms of being healthy. It has an environmental, obviously, effect. And it's multifaceted. And I think what's been really interesting in this conversation, Matt, is that there hasn't been a single point where it's a single touch point. It positively affects so many different things.
It does. And the effects are not only multiple, but they affect other people as well. They see you walking or cycling or picking up litter or whatever it happens to be, they're more likely to join you. So it's an inspiring impact as well. We get to see a lot of people who are trying to make a difference, and that just encourages more people.
And if that's one thing I'd love to take out of this podcast is that phrase, which is an inspiring impact, and if we underline anything on the back of this, that those two words, I think are kind of critical to the way we move forward on this. If we can make an impact that is inspiring and affect the things we discussed, over a multifaceted approach and have those benefits, I think that's a huge plus point. So thank you for that. That's been really beneficial. The other question I have is, so 10 years time, you and I are sharing a pint of Guinness in some very nice pub that just sells beer and doesn't do very posh food type things. And over that beer, we're talking about the effect that we've had during our career and what we've done over that period of time. What would be the thing that you'd most like people to say about you and the effect you've had?
I think really it's trying to be part of a movement that has led to such positive change that we've got benefits for patients and populations in terms of preventing illness at the outset. But also, help the NHS to reduce its financial expenditure, continue to improve staff morale and well-being and recruitment and retention, and from a planetary perspective, still have somewhere that is habitable to live. You may know that the hottest day in the last 3 million years was last week, as were the 7 hottest days of the last 3 million years. And on the same day as it was the hottest day, we had the most aeroplanes in the air as well. So actually for me, that long-term impact is, can we still have healthy lives where we want to do the right thing, but without causing the environmental harm that we are. So a habitable planet. So if I can retire in a decade with a health service that is thriving, population which has got less ill health, and we've had a lot of positive actions from a planetary perspective, I think I'd be very happy. It's a big ask, but and I think that we can solve all of these problems with environmentally sustainable and nature-based solutions. I don't think we're needing to, as I said before, wait for a billionaire to create something. We know what we need to do. We just need to be doing it now, not waiting 10 years to start doing it. We need to have succeeded in 10 years.
Fantastic. And with that, Matt Sawyer, I'd like to thank you very much. It was a fantastic discussion.
Thank you.
I think it was very impactful. It was very insightful. And hopefully, some of the outputs of this people will be able to follow. We'll follow up with some of the website addresses that have been mentioned on here. And thanks so much. It was a fantastic to catch up.
Absolute pleasure.
Thank you for listening to the Innovation in Healthcare podcast, produced by Health Innovation North East and North Cumbria. If you'd like to find out more about how we are working with partners across a range of disciplines to support the delivery of sustainable solutions for the NHS and its net zero plan, please visit the Improving Population Health section on our website at healthinnovation.org.uk/sustainability-showcase. We will, of course, provide all the relevant links in this episode's show notes. Thank you again for listening.